Imagine a world where a simple childhood illness could have devastating consequences for your family. Where a common cold could lead to lifelong complications, or even death. How confident are you in the health decisions you make for yourself and your loved ones? Are those decisions based on solid facts, or influenced by hearsay and misinformation? We live in an age of unprecedented access to information, yet, when it comes to vaccines, misinformation often clouds the truth. Today, we're going to cut through the noise and rely solely on science and facts. This video is dedicated to providing you with evidence-based information about vaccines, empowering you to make informed choices for your health and the health of your family. As individuals who value health, longevity, and overall well-being, it's vital that we understand the power of vaccines. Vaccines are, without a doubt, one of the greatest achievements in public health history. Yet today, they're at the center of one of the biggest health controversies in America. With the appointment of a new Secretary of Health and Human Services, discussions on vaccines have reignited across the country. Why do some people distrust vaccines? What's the science behind them? And what happens to countries without vaccines? Let's break it all down in today's video. A very brief history of vaccines. The story of vaccines begins centuries ago. Edward Jenner's pioneering work with smallpox in the late 18th century marked the dawn of immunization. Later, Louis Pasteur's breakthroughs revolutionized our understanding of infectious diseases. And the creation of the polio vaccine, in the mid-20th century, was a monumental victory against a crippling disease that once terrorized families. These milestones demonstrate the profound impact of vaccines on public health. They have dramatically reduced, and in some cases, eradicated, deadly diseases that plagued humanity for centuries. How do vaccines work? Let's take a simplified look at a complicated, yet vital process. At its core, a vaccine introduces a weakened or inactive version of a pathogen, a virus or bacteria, into the body. This doesn't cause the actual disease, but it does trigger your immune system to produce antibodies. Think of antibodies as your body's defense force. They're specifically designed to recognize and neutralize the pathogen. Importantly, your immune system also creates memory cells. These cells remember the pathogen, so if you're exposed to it again, your body can mount a rapid and effective defense, preventing you from getting sick. This process also contributes to what's known as herd immunity. When a large percentage of a population is vaccinated, it creates a protective barrier, making it difficult for diseases to spread. This protects even those who cannot be vaccinated, such as infants or individuals with weakened immune systems. Think about life before vaccines, and since vaccines. To truly appreciate the power of vaccines, we need to understand what life was like before their widespread use. Diseases like smallpox, polio, and measles ravaged communities, leaving behind a trail of suffering and death. Imagine a world where parents lived in constant fear of their children contracting a deadly illness. Today, thanks to vaccines, these diseases are largely a distant memory in many parts of the world. The eradication of smallpox in 1980, making it the first human disease wiped out by vaccination. Since then, vaccines have largely prevented deadly diseases like polio, measles, diphtheria, and tetanus. Polio, which once paralyzed thousands of children, is now on the verge of eradication. Measles, which caused millions of deaths, has been dramatically reduced. The numbers speak for themselves. Vaccines have saved countless lives and prevented immeasurable suffering. The World Health Organization estimates vaccines save 3.5 to 5 million lives every year. What is life like in countries with limited access to vaccines? In these countries, the fight against infectious diseases is far from over. In many developing countries, access to vaccines is limited, and preventable diseases continue to take a devastating toll. Children suffer from measles, polio, and other illnesses that we rarely see in developed nations. This stark reality highlights the importance of global vaccination efforts and the urgent need to ensure that everyone has access to these life-saving tools. Let's address myths and vaccine misinformation. Here are some of the most common myths and misconceptions that surround vaccines. These myths can create fear and confusion, leading people to make decisions that are not based on sound science. Myth: vaccines cause autism. This is perhaps one of the most persistent and damaging myths. Numerous scientific studies have debunked this claim. The original 1998 study that sparked this fear was retracted due to fraud, and its author was stripped of his medical license. Organizations like the CDC and WHO confirm that there is no link between vaccines and autism. Myth: vaccines contain harmful toxins. Fact: vaccines do contain certain ingredients, such as preservatives and adjuvants, but these are present in very small, safe amounts. They undergo rigorous testing to ensure their safety. The idea that vaccines are filled with toxins is simply not supported by scientific evidence. Myth: natural immunity is better than vaccine-induced immunity. While it's true that natural infection can provide immunity, it comes at a much higher risk. Diseases like measles and polio can cause severe complications, including death. Vaccines, on the other hand, provide immunity without the risk of serious illness. They offer a safer and more controlled way to protect yourself and your community. Myth: vaccines are a conspiracy by pharmaceutical companies. Fact: vaccines are a product of extensive scientific research and rigorous testing. They're subject to strict regulatory oversight by independent agencies. The idea that they're part of a conspiracy is a baseless claim that undermines public health. Myth: vaccines don't work because some vaccinated people still get sick. Fact: no vaccine is 100% effective, but they significantly reduce the risk of severe illness, hospitalization, and death. It's crucial to rely on credible sources of information, such as the CDC, WHO, and peer-reviewed scientific studies. Be wary of information shared on social media or from unreliable websites. Critical thinking and a healthy dose of skepticism are essential when navigating complex health information. Let's explore recent developments. The field of vaccinology is constantly evolving, with researchers making remarkable strides in developing new and improved vaccines. One of the most significant advancements in recent years has been the development of mRNA vaccines. Unlike traditional vaccines, which introduce a weakened or inactive pathogen, mRNA vaccines use a small piece of genetic code, messenger RNA, to instruct your cells to produce a harmless protein that triggers an immune response. This technology offers several advantages, including faster development times and greater flexibility in adapting to new variants of viruses. Scientists are also exploring other innovative approaches, such as vector vaccines and protein subunit vaccines. These technologies hold promise for developing vaccines against a wider range of diseases, including cancer, chronic illnesses, and personalized vaccines. Ongoing research is also focused on improving vaccine delivery methods, making them more accessible and user-friendly. Furthermore, global initiatives are underway to ensure equitable access to vaccines, particularly in developing countries. Organizations like the Gavi Alliance and the WHO are working tirelessly to strengthen immunization programs and deliver life-saving vaccines to those who need them most. One of the biggest challenges now is ensuring global access to life-saving vaccines while addressing public concerns with transparency. These advancements represent a beacon of hope in the fight against infectious diseases. The future of vaccinology is bright, with the potential to eradicate even more diseases and improve the health and well-being of people around the world. The future is exciting with new medical discoveries daily and the outlook is hopeful. In conclusion, vaccines are a cornerstone of public health, offering a safe and effective way to protect ourselves and our communities from preventable diseases. By relying on science and facts, we can make informed decisions that safeguard our health and the health of future generations. Let's embrace the power of vaccines and work together to create a healthier and more resilient world. Looking forward to a future where we eradicate all diseases worldwide. If you found this video informative, please like, share, and subscribe to our channel for more evidence-based health information. Visit our website for additional resources and references. Remember, your health matters, and informed decisions make all the difference.